Welcome to the Revitalize Women podcast with Dr. Brenda Heineke, where we bring health and wellness professionals together to talk about all aspects of women's health, from pregnancy to menopause and everything in between. Hey everyone! On today's episode with Dr. Katarina Meister, we talk about various ideas on optimizing health naturally without doing crazy diets, taking medications, or having to make drastic lifestyle changes. Dr. Meister is a naturopathic doctor at Lakeside Natural Medicine in Shorewood, Wisconsin, and she helps people with chronic fatigue, hormone imbalances, and autoimmune disorders, just to name a few. In addition to giving you a lot of different ideas to try for optimizing health naturally, we also talk a bit more on the different approach she takes compared to the traditional medical pathway and when someone would benefit from a naturopathic medical approach. If you're looking for a natural approach to health, I would highly recommend reaching out to her at Lakeside Natural Medicine. So I really hope you enjoyed today's episode. Let's dive in. Welcome, Dr. Meister. It's great to have you on the show today. I'm really looking forward to talking.
Yeah, thank you so much for inviting me.
So can you just give everyone listening like a little bit of background? How did you get into naturopathic medicine?
Yeah, definitely. So as a, young high school student, I always knew that I wanted to be in the medical field. I started shadowing doctors and nurses and kind of got a good grip on, what, healthcare is. And I decided to be pre-med in undergrad. So then I went to the University of Iowa. And while I was enrolled there, I went through my own personal health journey. During that time, I started struggling really bad with acne, and I tried, most over-the-counter options over-the-counter first. And then I went to the dermatologist, tried most first-line treatments there. And after, several unsuccessful attempts, I tried Accutane, which is a derivative of vitamin A, if those are unfamiliar, and it's used for severe cases like mine. And after about 6 months on Accutane, I started to develop joint pain, gut symptoms that I wasn't having before. And at that point, I really had to take a good look at, what was worth clear skin at that point for the sake of my entire health. And so I decided to discontinue Accutane. And after that process, I was still struggling. I had acne still. I still had gut dysbiosis going on, lots of new symptoms that were still there. So I decided to seek out a natural doctor. And so I literally just Googled search natural doctor. And in my hometown, there was a naturopathic doctor. And so after, my first experience seeing this naturopathic doctor, my entire life and viewpoint of healthcare had changed. So the visit was, an hour long. I got to talk to the doctor for that entire hour's length in time. It wasn't a 5-minute quick stop. And I really got to express what was going on. She could do the functional testing that was appropriate. And, my energy levels, my mood, my acne all cleared up within, 3 months of dietary and lifestyle changes. And then I found out that the root cause of my acne was actually a dairy intolerance. So after all of those years of struggling and not really emphasis on the diet or any kind of like lifestyle approach, I was pretty blown away. So after that, I decided just to switch my applications in college to naturopathic medical schools.
That's awesome. That's such a great story too, of like how you've seen it firsthand. And I'm sure you can relate then so much to your clients kind of going through similar issues.
Definitely. And just like having an appreciation for conventional medicine, but then also realizing that there's a time and place for other types of medicine to shine.
Yeah. Do you feel like a lot of the people you work with have kind of gone through something similar where they've maybe gone the more like traditional route and it's not working, or they're just not liking kind of the path they're on and then they sort of switch over?
Yeah, it's kind of funny because a lot of my colleagues throughout, naturopathic medical school and even interviewing doctors, naturopathic doctors in the field, I've just seen how most of them actually were quite chronically ill. A lot of them are, or they, struggled and then they got through it and passed it and healed themselves. But yeah, a lot of people in this field somehow had their own health tidbit that kind of drove them into this field.
Mhm. What do you feel like is kind of the biggest misconception about the field, or um, maybe like what tends to keep people from seeking out help through like naturopathy?
Yeah. So I think the biggest misconception of naturopathic medicine is that we didn't go to medical school and that we don't have proper medical training. And that's actually quite false. And so our naturopathic medical school is very similar to conventional medical school. We go to a 4-year curriculum. You have to take prerequisites just like, an undergrad in all the basic sciences. And then the first 2 years, are dedicated to all the basic sciences all over again in naturopathic medical school. And then we get that clinical training for about 2 years after that, 2 to 3 years. And then we have to sit for licensing exams after we graduate in order to practice naturopathic medicine. So there is a lot of regulations around it. And Wisconsin actually recently became a newly licensed state for naturopathic doctors, which is really great. Because it can help bring more awareness to naturopathic doctors who have been to the proper training. There are also, lay naturopaths that are practicing that did not go to naturopathic medical school. And so there is a confusion there, but with licensure that can help to prevent the confusion. And there will only be one licensable naturopathic doctor that has to meet those requirements and the continuing education requirements as well.
So it's kind of like if if you're in a state that doesn't require licensure, like almost anyone could say they're like a naturopath essentially, but like not
Essentially,
a naturopathic doctor. Like, is that
cor-
kind of the
correct. Yeah. In unlicensed states, lay naturopaths could be calling themselves naturopathic doctors, even. So the licensure just helps to promote patient safety and, helps patients be able to shop for a doctor that is trained in both conventional and natural treatments. That's what makes a naturopathic doctor unique, is that not only are we trained in pharmacology and all of the conventional treatments, we learn the natural ones as well. So botanical medicine, homeopathy, hydrotherapy, physical medicine, those kinds of things we also learn.
interesting? Um, so I want to kind of dive in a little bit on some of the things that you treat. I know with you and I talking beforehand that you do see quite a few people with like hormone imbalances. Uh, and I feel like just from what I've seen, like with clients, I feel like a lot of people going through any kind of like hormone fluctuations, like the typical solution is hormonal birth control or like a hormone replacement therapy. Um, how would you say, like, how do you kind of tackle those issues and like what does that look like?
Yeah. So hormones are interesting because, like you said, it's often a quick fix for most women who go to see a doctor, a gynecologist. They'll say their hormones are unbalanced, and then they'll be prescribed birth control. Most often, that's the case if they're premenopausal, or if they're in their menopausal years, and they'll be prescribed, hormones to help them transition out of menopause. But as a naturopathic doctor, I like to look at the root cause. And so um, there's three things that when you want to look at hormones, we have to consider the adrenal glands, the thyroid gland, and then your female sex hormones. And so often what happens is if there's any imbalance in any of those, one of those three areas, then there can be distance or, other types of imbalances in those other areas. So your mood, your energy, your libido, your sleeping pattern, your metabolism, all of those things are affected when one of those things goes awry. So the first thing that we do as naturopathic doctors is, especially at Lakeside, we really emphasize food as medicine whenever possible. And I think that's kind of what sets our clinic apart from other naturopathic clinics, is that we really emphasize the nutrition first and the lifestyle changes. So before we even run hormones, we do those changes first. And so we teach our patients, how, foods that we should avoid to decrease inflammation, promote hormone balancing, and to support your stress glands, your adrenal glands, and your thyroid.
Awesome. Do you ever, I feel like I've been reading more about like seed cycling as a more like natural way of trying to balance things. Is that something too that like you incorporate in? Or I know like the research is not super abundant on it, but
there isn't a lot of, that's the research is coming, which is good. But seed cycling is a great way to get in those healthy fatty acids into the body, which are, we need those to build hormones. We need the backbone of hormones before we can even balance our hormones. So we have to make sure nutrition is good. So seed cycling is a great way that you can rotate seeds during the follicular phase and the luteal phase of the menstrual cycle. And it also can help even menopausal women transition better through menopause by emphasizing the flax seeds. Flax seeds are unique because they are phytoestrogens. So they contain plant estrogens that are weaker than traditional, bioidentical estrogen, that helps to either increase estrogen when it's needed or decrease it when it is no longer needed. So in premenopausal women, or women between the ages of like 16 to 50, let's say, these types of women might be struggling more with estrogen dominance and progesterone deficiency. So getting in enough essential fatty acids helps to kind of round that out a little bit. So the two seeds that you'd want to focus on for the follicular phase would be either pumpkin seeds or flax seeds. And then the luteal phase, you want to use sesame or I'm trying to think of the other one really quick. Sunflower. Yes. Thank you. Yeah. So, you want to rotate those two, and that will definitely help. But sometimes it's not the end all be all. So that's when you would want to do some hormone testing to see what else is going on.
Mm-hmm. So I know you said like typically your approaches address some of the food aspects first, like right off the bat. How long do you have someone start to make those changes before you would expect to see some kind of result or like symptom resolution just based on dietary change?
Yeah. So I think for hormones, usually if it's a lower intervention like nutrition, lifestyle, or even dietary supplements, that can be a lower intervention compared to like a medication or a bioidentical progesterone cream. Those longer or lesser interventions we usually take around 3 months so that the hormones can cycle at least to, get up to speed. Sometimes the change will be sooner than that, just depending on the person. So, everyone is different and they're going to respond different to different interventions. Some people are really sensitive and then they respond really well to just diet. So I would say at least 4 to 6 weeks to see, moderate change. You might start to see changes in energy, mood, and then the hormones come after.
So I know you also said like you're kind of like the 3 systems, if you will, like thyroid, adrenal, sex hormones. What do you feel like is the most common, like dysfunctional one that you see in women that you work with?
I would say adrenal fatigue or adrenal dysfunction. So our adrenal glands are those small little glands that sit on top of your kidneys and they secrete epinephrine when we need to like run from a bear. They also secrete other types of hormones such as cortisol, our stress hormone, when just moderate stressors arise. So even if you feel like, you have lots of stress, but you can manage it well, that's your adrenal glands that are kind of taking over at the point where you feel like you can no longer tolerate stress. You're staying up late, you're like a night owl, or even you're waking up really groggy in the morning. That's where you're going to see changes in energy and mood and sleep patterns. That's where your adrenal glands come in. And your adrenal glands are unique because in menopause, these are the glands that are responsible for creating most of the estrogen in your body, besides your fat cells. So once the ovaries shut off, it's your adrenal glands that are responsible for that. So that can cause, heightened menopausal symptoms, more night sweats, more hot flashes, than you would typically see. Let's say one friend has it more than the other. It could be just adrenal dysfunction. So I see it a lot, especially in, even younger women, who even have, metabolism issues. Decreased cortisol can actually impact your thyroid. So when you lower your cortisol, you actually lower your metabolism. So you're going to have less free T3, the active thyroid hormone, available. And you see that a lot on thyroid testing.
That's interesting. And I never thought about it from a menopause standpoint with that either, that could almost exacerbate those symptoms. That's super interesting.
I know it is. And it's when you fix the adrenal glands, then, then they start to have, a better transition. They can tolerate the night sweats, or, they'll go away in frequency. Even just utilizing flax seeds really helps with that, balance out the estrogen a little bit. But yeah, I definitely see that a lot in my practice. And when we test hormones, sometimes we don't use, any bioidentical progesterone or anything of that nature, and we'll see the hormones re-regulate just on their own.
We've been using here at the office HRV software, so heart rate variability, a little bit with some of our clients to see kind of like the stress and recovery, like balance throughout the day, which is really interesting, and trying to take that into account with our practice. So like if you have someone that is very like high stress levels, like they don't have a lot of recovery built into the day, their sleep isn't great, like we're trying to take that into account too. What are we recommending in terms of like exercise or home program? Because I feel like in it, you can like see it too with HRV. If they're doing really intense, hard workouts, like their body just like can't recover from it. And so, if we're just like adding to that, what are we really making a big difference for them long term?
Right.
Or just exacerbating the cycle.
Yeah. And that's why, HIIT workouts aren't for everyone. And that's, not everyone does good at like a burn boot camp, for example. So like weightlifting, yoga, stuff that's slower is better in those cases. And I think another good sign is that you should never feel completely exhausted after a workout. You should have energy. You should be able to keep moving throughout your day. And that's interesting about the heart rate variability, because we did that a lot with biofeedback and just the breath, and really slowing down and teaching the body how to cope through stress can really help.
Mm-hmm. It's so eye-opening too, the effects that alcohol has like on your sleep.
Yeah.
When we first got it, I did it on myself as just like a test run. And one of the nights had like a glass of wine before bed, and it was crazy. Like my body was in stress state for like hours.
I know. It literally, sugar and alcohol like literally causes your body to secrete cortisol. So then you're going to have blood sugar dysregulation, because cortisol and blood sugar go together. When one rises, the other rises. So yeah, I know. Once you take out even that glass of wine, it just really transforms your entire day for the following day.
Yeah, it's really made me second guess, like especially in, times where you're like more stressed, you're busy, and you're like, oh, it would be nice to like unwind, have a nice glass of wine tonight. And then you're like, it's actually probably like the last thing that you need when your body's already stressed.
I know. And it's just like these habits that we get into from, just like a young age, of even just generational, seeing your parents do it, even and just learning new habits. So like replacing that, like still do that same activity of drinking something, but just replace it with a tea, or even you could do like a tonic and lime, or, something lower sugar so that you're not suffering the next day,
Mm-hmm. Yeah. Yeah.
Easier said than done, but definitely can help. Yeah.
Right. I know.
Hey, are you looking for a fun night out with your girlfriends where you can socialize, get a break from the daily chaos, and learn a thing or two about your pelvic health? Register for our upcoming event on Wednesday, October 19th to learn about the common issues women deal with throughout their life, how to resolve them, and easy ways to improve your pelvic health. We will even have pelvic floor safe food and drinks that night to show you what you can do for your pelvic health. So make sure you grab your ticket and invite a friend to join.
So I'd like to talk a little bit more on gut health as well, because I know, especially in our realm with pelvic floor, there definitely is such a link with a lot of pelvic floor issues and gut health. And so I guess one of my questions, like my base understanding, when you're addressing gut health is oftentimes people will do like a full elimination diet and then kind of like slowly add things back in to try to help heal the gut, but also like determine if there's certain sensitivities or intolerances. But is an elimination diet like always necessary when you're trying to like improve gut health?
I wouldn't say it's always necessary, only because sometimes if there is dysbiosis in the gut, or small intestine, large intestine, you're going to be sensitive to different foods because of that dysbiosis. So sometimes the food sensitivity testing even won't be accurate, or your elimination diet won't be entirely accurate of why you're sensitive to those foods. So I would say you'd first want to rule out to make sure there's something else going on. But removing any food that causes inflammation is key to healing the gut. And that's where less so about eliminating, more so about emphasis on the right types, or not the right, but it's a tricky balance with food, and we have to be really careful about calling a food quote unquote bad or good, because that can lead to disordered eating. But removing foods that cause inflammation is key to healing the gut, especially if there's been long-term, inflammation going on, or just depending on what the person is going through. So such as SIBO, small intestine bacterial overgrowth. This is where there's lots of bacteria in the small intestine when it should be in the large intestine. And this could happen because of low stomach acid. This could happen from a leaky gut or those food sensitivities that I kind of talked about. Or it could be happening because of, just low digestive enzymes. There's a variety of causes. Medications can cause it. And so healing the gut for that case would be starting a low FODMAP diet. And that would be a temporary transition into the treatment of SIBO. And then eventually you'd reintroduce those foods back in. But the goal is to have a diversified diet. So the more diverse your diet is, the better off you are overall. So the more you can tolerate different types of foods, the better off your microbiome will be in the long run. And so that's really what's key, is the diversity of the whole foods and vegetables.
I know gluten gets a bad rap too, like for inflammation. Are there certain things people can do, like if they really are not willing to cut gluten out? What would kind of be your recommendation on that?
I know it's tough when we have the dietary changes and we have resistance with it, because we're fearing loss of that food, and we feel like we're stuck in this box where we can't eat anything anymore. And so it's really just opening their eyes to all the other foods that they can eat. And so that's where I would start with that person, is just showing them how much you still can eat, and how gluten-free grains are out there that are whole grains, like quinoa. That's a really good one. And just shifting their mindset on that one. But gluten can cause lots of issues for people with Hashimoto's or autoimmune thyroid disease. And so eliminating gluten in that case is imperative to save the thyroid. But for gut health, if there is, celiac disease or even a sensitivity to gluten, that's going to another autoimmune disease, celiac disease, and that's causing permanent damage to the small intestine. And so removal is imperative. But for sensitivities, depending on how sensitive you are, I would recommend removing it entirely if you have any symptoms. It's kind of like tricking your mind into doing something that will be good for you. So for me, for example, I went dairy free, and that was like the end of the world for me when I first found out that I was sensitive to dairy. But then I found all of these, other foods that I could eat, and it was an easier transition.
Yeah, I'm sure probably having like good guidance with that is imperative, like especially if you're, at this point where you're like, what am I going to have? Lettuce? Like, I feel like
Right.
I've heard that from people, and like, they are just not as aware of like the other options out there.
I know it can be tricky. And that's why I really like our workshops. We host a bunch of workshops, every quarter or so, but we kind of teach everyone to how to cook fast and efficient. I feel like that's usually the best way to cook is where you don't have to think too much and it still tastes really good. Some people, if they want to really get into cooking, then you can go all out, but just to start, just throwing like cruciferous vegetables on a pan, salt, pepper, olive oil, it's so good. And that's like your side, and that's a carb. And so you could do, cruciferous vegetables that way, which is good for your hormones and fiber. Then you add a protein and then some kind of healthy fat like an avocado, and you got a meal. So it's really just about, if they like carbs and just finding other types of versions for them.
Mm-hmm.
The gluten carbs. Yeah.
Right. Yeah. I think I've read books and articles too, where it just is, like you said, kind of this mindset shift of like looking at food as like fuel for the body, and like that, trying to get like this wide range of things just really helps overall health, and like giving your body options versus like, oh, I can't have cheese curds at the state fair or something.
Yeah. And it's also about moderation too. Like cheese curds is a good example, because like one, a special occasion, like I'm going to have some cheese curds, but most of the time you should be trying to eat towards just a diverse diet. Like we're kind of talking about, getting in plenty of greens, protein, fats. But there should be it shouldn't feel like you're living a restricted diet by any means. So if that is the case, then there's some things to work on of just helping you, if gluten is an issue. But if it's not an issue, then finding ways to include more whole grains and stuff like that.
Mm-hmm. So what would be kind of your best advice for like a busy working woman on how she can like optimize her health?
Yeah. I would say the best way is to get into a really good routine. So you wake up, you either exercise in the morning or you choose to exercise at night. You kind of have, when you're going to exercise, so that you can kind of plan your day around that. So you wake up, let's say you exercise right away. You could start your day off with a smoothie. That way you get in some greens, some fruit. You could add in your seeds if you want a seed cycle into that smoothie, and it's a good balanced meal that's going to get you through lunch. So improving satiety, having balance with insulin and glucose is going to lead to long-term health. So then you go to work, you have your lunch with you. If you want to bring, a salad, I like doing bowls. So you could do, some cruciferous vegetables in there, kale, and then quinoa or brown rice, and some chicken or some type of protein. And then I'm kind of just going through the day, but ideally, 3 meals a day is ideal. Some way to wind down after work would be good. So that whether that's a walk, doing something social, that'd be good. Wind down, have some dinner, and then, make sure you make time for sleep, and then getting in enough water throughout the day. So really just getting in a good routine of, 9 cups of water, 9 hours of sleep, 3 meals a day, something to exercise, something to do to exercise, and then something to do to kind of wind down. I would say that's how you're going to live a healthy, balanced life, is just making sure that you're getting these things. And then, on the weekends, you can be less strict, but I think the routine really does help just with your mood and energy, and just helping fight, dailies and anxiety, the Sunday scaries, helping with that, when you're really organized and have a routine that can help just reduce a lot of stress in your life.
Yeah, and I'm sure too, like anything, if it's a routine and you're scheduling it, then you're prioritizing that versus spending time like trying to figure out like, what am I going to do today, or what am I going to eat for lunch today, or things like that. Like it's just kind of a automatic. You can like go through it almost autopilot to some degree with.
Yeah. And that's not for everyone. It's not for everyone. It does really help though, if you do struggle with anxiety or depression, because when you force yourself to do those things, it just helps overall mood and energy. So, it's just a great way to balance your life out, with a really busy schedule. And when you are really busy, taking time on the weekends to meal prep a few things, put them in the freezer so that you don't have to cook every day, or have that easy, the crucifer specials on a pan, or, that roasting ability is really quick and easy. Just knowing meals that are quick and easy to do that still satisfied your needs.
Mm-hmm. So tell everyone, where can they find you if they want to connect or follow you for more advice? Where can they find you?
Yeah, so they can find me on Instagram at Dr. Katarina Meister, and also at Lakeside Natural Medicine. 2 different Instagrams, one's for the clinic, one's my personal page. And then they can go to www.lakesidenaturalmedicine.com and just see more about it. And if you mention this podcast at your booking with me, you'll get 20% off your new patient visit. So there's one incentive for listening to the podcast.
Awesome. Well, I'll definitely make sure that all of that is linked in the show notes too. So if you're listening to this and can't write it down, you can always head there. And so last question for you, I ask everyone on the podcast, but I feel like it kind of ties in with the last question, but what is your current favorite way to practice self-care?
Yeah, I would say for me, it's the Epsom salt baths that I've been doing just to replete magnesium levels, and electrolytes. So I don't know if you've heard of Element electrolytes.
That's what I do. Yeah.
Oh my gosh, they're so good. This is my new thing, but it's just like a nice, instead of like an alcoholic beverage, that's what I'll do to start my day, or instead of coffee, I'll do that. But those have been like my 2 favorite things right now.
I know the lime one, I swear it tastes like a margarita.
I know, it's so good.
I know. I did that when I was pregnant with my last one. I had to do electrolytes every day. Otherwise I felt really crummy.
Yeah.
Which was like a new thing for me. But I was like, oh, this is really good. It's a nice change from water.
Yeah, exactly. And if you struggle with like thirst or just, drinking water, it can help because it's so salty. You need to put it in like a big glass.
Mm-hmm. Yeah. Awesome. Well, thank you so much for taking the time today to talk with us, and I really appreciate having you on today.
Yeah, thank you so much.
To tell you your pelvic floor tip of the day, pay attention to your sparkling water habit. It just might be making your leaking worse or giving you more urgency. So pay attention and see if you notice a pattern with that. And also don't forget, make sure you grab your ticket for our upcoming event, October 19th. It is going to be so much fun. It'll be a great night. Invite a friend, but grab your ticket now because space is limited and we will not be able to have everyone there that night. Unfortunately, we're going to keep it a bit more small and intimate of an event. So make sure you grab your ticket before we sell out. Okay, I hope you all have a great day, and I will talk to you on another episode.